About 1.16 million Americans are arrested annually for drug-related offenses. 26% of all arrests in America are related to drug offenses. 80% of prison inmates either abuse drugs or alcohol. For many years, the U.S. has implemented many new laws and strategies in efforts to help address the national ongoing drug crisis. However, what they are failing to recognize is the need to have a more harm reduction approach when addressing this crisis. In 2001, Portugal became the most prominent and influential country in the world to decriminalize the consumption of all drugs. Portugal increased their focus on harm reduction approach and treatment provision. As a country, they were determined to treat their drug crisis as a health concern and not a crime. Since then, they have seen a significant decrease in drug use rates overall, while also providing a framework for other countries to use the same approach. With supporting evidence that has been seen in other countries, such as Portugal, if the United States were to shift and reform their policy to decriminalize the consumption of all drugs, the drug use rate overall can decline. Individuals that are facing issues with substance use will be sent to appropriate treatment facilities to get proper medical care. This reform policy will then highlight a greater need for funding on rehabilitation programs, and the funding for these programs will come from the amount of funding that is normally given to prisons by the American taxpayer. Essentially, we are redirecting the funds to rehabilitation programs for individuals that normally would get penalized for drug use. With this reform policy, individuals caught with drug possession in small quantities will either receive a small fine or given community service instead of jail time. It is very important to understand that if the U.S. were to decriminalize the consumption of all drugs, that does not mean there is legalization of all drugs. All drugs will still be illegal. However, the whole point of this approach is to treat drug use and possession as a health issue instead of a crime.